All right, guys, I'm very excited about today's guest, Dr. Janet Lintala. She is the author of the book, The Unprescription for Autism, which is one of my favorite books when it comes to supporting our kiddos with special needs. And I think that the foundations in this book go far beyond kiddos with autism. It really goes for everybody out there in terms of optimizing your health, but all of our kiddos with special needs in particular. So thank you so much, Janet, for joining us, and thank you for writing this incredible book.
Thank you for having me. I'm excited.
This is going to be fun. So I rarely meet other doctors who are sort of on the same wavelength with me in terms of really optimizing the foundations for our kiddos before we move on to more advanced interventions, right? So tell me how you got into the autism space and why this is such an important community for you to work with.
Well, I got into it as an autism mom. I mean, the night that I brought my little baby boy home from the hospital, I didn't know it yet, but I was already an autism mom. And I wouldn't find that out for about 7 years. And I kind of had to figure it out on my own because he's 31 now. So this was way back in the dark ages. And that's back when we were told, oh, there's nothing wrong with him. You're a bad mom.
Oh,
It's
I even got that a couple years ago when Remy was before Remy was
it's
diagnosed.
your fault. Why are we having this conversation? It's you. It forced me to really dive in. I have a highly verbal son who's super intelligent. And, when they talk that much, I mean, he actually couldn't quit talking. Autism is not what leaps into your mind, especially 30 years ago. So finally, we did get a diagnosis, and he was one of the ones that really had a lot of irritability and aggression, not to people or babies or animals or anything like that, but around the house, very destructive around the house. He started out as a sunny little baby and toddler, but then I realized he was unhappy all the time. Okay. And so I was looking for help with behaviors, difficult behaviors. He never slept. He had wild gastrointestinal problems like diarrhea and just didn't digest things well, and all these difficult irritability and anger issues. And so I was given prescriptions because back in the day we didn't know what, or we did know, but mainstream doctors didn't know what we know. And to be honest, I'm a chiropractor, I'm a non prescriber, I'm not against prescriptions, but at the time it seemed reasonable that my son might benefit from them. And I was grateful, and they seemed to help a little at first, and I was grateful. And then they didn't help as much, and they had to up the dose, or they had to add a second medication, or this or that. And I just began to realize there's something more going on here. And I began to realize that even though lack of sleep and irritability and GI problems seem like the problem, and they are problems, they're big problems, they were symptoms of something much deeper. And I began to go to conferences first as a parent. And then I realized, hey, I've got a degree in genetics. I can understand all this science stuff. And I started attending the clinician track and really learning about what was going on inside my son. And I have three boys, and they're not all autistic, but siblings of a child with autism families. There's a genetic component there. And they all have issues that are related to the gut or the brain or inflammation or the immune system or methylation issues. I mean, the list is endless. Yeah,
It is impressive when you start looking at the various different things that we have to optimize and look at with our
oh,
kiddos.
wow. I always say I've had a 30-year residency in this. I had the full experience, the full thing. And so, really, that's how I got into it. I began exploring it for my own family, discovered that, hey, this is going on everywhere. And the numbers are increasing. Are we more aware? Is it environmental influences? But other people need to know this. And then I started doing free workshops to first I was meeting with people one-on-one, and then I felt like my jaw was going to fall off from all the talking I was doing, explaining to people. There would be 5 people this week, and I'd say, why don't you all just meet in my kitchen and we'll just have a little workshop. And then we finally outgrew my kitchen, and a local grocery store where we like to purchase our organic foods or our gluten and dairy free foods began hosting them. And then it just exploded. And I ended up opening an office, not because I had time to have a practice and see patients, but I thought, oh, I'll put all the papers there, all the phone calls can go there, all this chaos that's in my home can go to this little office space that I envisioned, getting it away from my home. And then within 6 months, I had to hire a full time office manager, and we had patients coming soon from 20 states, and it was just nuts. My doctor started going, "You need to write a book." And I'm like, "Who are you kidding? I'm not a writer. I don't have time. I don't know if I can say this on your podcast, but I would say I don't have time to sit down and pee. I just am busy. There's not enough time in the day." But you know the story. Eventually, I did find the time, is because I felt passionate about sharing it with other autism parents and families, this knowledge that was life changing. And wrote the book and have my practice. And now I'm on a speaker's bureau. I don't know. It just grows. You've done the same thing, I'm sure.
I have, yeah. No, it's wonderful though. And as you said to me before we started, it is a calling. It's something that brings us in, and it's the universe is telling us that we've got to help. And when you have kiddos with special needs and you're seeing them thrive and start to change the tide, especially after navigating the aggression and the outbursts, that can be incredibly tough. That's something that a lot of moms reach out to me for support with. It's really life changing when your kids start sleeping and are able to regulate themselves enough to be able to be comfortable in the home and to be able to be safe
Right.
with others. It's huge.
Yeah,
So
you
tell me,
realize they're not bad kids. They're not irritable. They're not sleepless. They just have issues that have not been properly supported. My children, my boys are all independent. We all live in different time zones now. They all have girlfriends. That's the good part. They're Eagle Scouts. They drive. They've been to college. It's just wonderful they still have challenges. I'm not saying life is perfect, but we understand them now and we know how to approach them. And you know how that makes your heart sing as a mama, to see your child thrive with vibrant health and be the best person that they can be. It's
exactly. That's all of our goals, no matter what our kids are navigating. Just helping them live their healthiest and happiest life is the best thing that we can do for them. And one of the things that I really love about your book is that you break it down in such a beautifully systematic way, because it is so overwhelming for parents who are just being bombarded with information. So I'd love to hear, sort of, when you have a client, a patient come in, or when you're talking to a mama, like, what are the things that you start to look at first when you're assessing a kiddo or an adult who's navigating some sort of neurodiverse challenges?
Well, I'm always looking for the often invisible underlying medical issues. And as we sort of touched on before, it's a pretty big list. I
Mhm.
mean, gastrointestinal dysfunction, immune dysfunction, inflammation is a huge problem, mitochondrial issues, the vision issues. They always have sensory issues. Vision is one of those five senses. Are we going to assume that the brain is coordinating those two eyes together? It's not doing anything else, right? Sensory wise, why would we assume their vision is okay? So I actually have a pretty extensive questionnaire that I've developed over the years. I'm always happy to share it with people if anyone wants a copy to look at. But I'm asking questions in each of these areas because I'm looking for, one, what can I do, help the family do to support these appropriately? Two, through this questionnaire, I can spot areas that I might need some lab testing, although I don't tend to lab test early. I already know what I'm going to do based on certain answers to these questionnaires, and I use my lab testing later to fine tune or if we've hit a wall or something. And three, I'm looking for appropriate referrals because no one healthcare practitioner can handle all of this. So if there's anxiety or depression, which is way more common on the spectrum, I'm not going to handle those. I mean, I may offer some calming tips or calming supplements or something, but I don't treat certain things. I'm going to make a referral to the developmental optometrist. If they don't have, usually the school will take care of speech and occupational therapy and things like that. But I'm always looking for a few referrals here and there. If they're high school age and they have an IEP and a diagnosis, I'm going to get them in with the Division of Rehabilitative Services, the DRS, because 15% of their national budget is dedicated to the high school age. And they
Oh,
have summer programs and job shadowing and preparing them for college or for work or for what, there's just so many resources there that they don't have to pay for. So I'm really spending about an hour and a half to 2 hours with my new patient. I'm wandering through all these different healthcare areas, kind of screening and making up my treatment plan or my referral plan, and I'm noticing patterns. So that's basically how I do an intake on a new patient. It's quite the process. It's not a 15-minute visit. So I tell them to pack snacks, bring toys, whatever you need to do. So,
yeah, I love it. It's so nice to work for yourself as a practitioner and be able to dedicate that level of time and energy to really uncover what's going on with the kiddos, because our kids are so unique and their challenges shift over time. And clearly, the parents and the kids are not getting that sort of support or that time and that depth from the Western medical system. I actually just interviewed somebody who's a Western doctor on medical gaslighting. And I was so excited about interviewing her. And then her whole spiel is sort of like putting the onus on the patient to understand that Western medicine isn't good at basically treating anything except for like serious disease, and they should go elsewhere and not expect that from the doctors. And I was like, well, shouldn't we put some pressure on the doctors to learn more about the things that are actually working for patients with chronic health disorders instead of just expecting the patients to pay tons of money? I don't know. It was a very interesting conversation. She was lovely, and I think the work she does is great, but the Western medical system does frustrate me quite a lot. And so I do think it's really beautiful to be able to make that connection with your patients and take that time, because as we've been talking about, there are so many different facets of health. And when we're talking about kids with special needs, the hits that we can take when we're healthier, more neurotypical, can really impact our kiddos so much harder than they hit us. Like, for example, I told you I was living with my son in a moldy house. Remy was screaming and scratching my face for hours and hours a day. Whereas for me, it significantly impacted me, but it impacted me in brain fog and some anxiety and some sleep stuff, you know? So they really take the hits a lot harder. Tell me a little bit about how you start addressing and looking at the gut, because I find that that's personally my favorite topic.
that's where I live, is in the gut. And I have patients come in, and just like I'm sure you did and I did, they'd been on the internet, and oh my gosh, they're overwhelmed. Do I try camel milk? Do I try this? Like, there's 50,000. The internet is not what it was back in the day like it is now. And they don't know where to start. And I'll put this on my presentation slides in a speaking presentation, and I'll go, where do I start? The gut, the gut, the gut. Got it? The gut. Okay. Are we clear? It is the gut. I start nowhere else. Even if I don't think you or your child are a good candidate for a gut support protocol, we're going to look under that rock anyway, because a certain percentage of my practice will respond. They're like the subtle subclinical people. So I use very conservative methods. I'm not going to do something to your child that I wouldn't do to mine or to myself. It's going to be very gentle. So let's take some time and look under it. So where I start is always with my autism patients, start with digestive enzymes with DPP-IV. And that is because of the horrible chronic prevalent constipation that is in about 85% of my patients. What do we do with this constipation? So Western medicine is very comfortable going stool softeners for life. Just get on it and stay on it, and that's all you can do. That's just part of autism. Well, there's a tendency there, but there's a reason. And years ago, when I began to understand the reason, I didn't quite grasp it. I'm hard headed. It took me a while to get it. Okay, so I was listening to Dr. Devin Houston. I do not make anything from his products or anything like that, but he's a world renowned enzymologist. And he was explaining that when American diet's very heavy in wheat and dairy, usually, and 50% of autistic children and adults are missing various digestive enzymes, and especially one called DPP-IV, dipeptidyl peptidase 4, that while we digest gluten and dairy, it gets broken down. Enzymes are attacking it and chopping it into smaller peptides. But there's one that's usually missing or damaged by environmental toxins, the DPP-IV, and the peptides that it leaves undigested when that enzyme is missing resemble morphine. And they're called casomorphins from the casein in milk and gluteomorphins from the gluten in wheat and gluten containing grains. And if it resembles morphine, well, hello, opiates are very constipating and they're very addicting. So now we have kids who only want to eat goldfish and pizza and nuggets, and they want a gallon of milk, some of them, depending on their texture issues. And it's like you don't realize it because that's what the American diet is heavy in anyway, is wheat and dairy. And so this constipation is a huge source of misery. I mean, it's a source of distress and pain behaviors. It's a source of a lot of that irritability and
Mhm.
destructiveness. And so that's the very first thing that I'm going to work on, even if your child wasn't constipated. Mine wasn't, and it took out 80% of his behavior problems. It was unbelievable, but it did for him. And I was cynical and I thought Dr. Houston was just trying to sell his enzymes. And I was we have to do this diet, this gluten free, casein free diet, which is so difficult and makes our life impossible to eat out. And it just turns out that I don't push that diet. I love these enzymes. They clean it all up. You can introduce them slowly and gradually so that there's a slow opiate withdrawal instead of an abrupt cold turkey. Let's quit those opiates right now. That's the way it was done to me years ago by the doctor I was working with. And I thought, Chloe, my house was going to burn down. He was one of the most difficult withdrawals I've ever seen in my life. I've only had one other patient match the volcanic 3-week anger. And so we just did it wrong. So I always tell my patients, I've made all the mistakes for you. I've gone ahead and figured it out. Okay. And I wean them very slowly onto these enzymes. Sometimes it takes 6 weeks or 2 months. Okay, now as moms, we want to get this thing cleaned up yesterday, right? And rushing is the enemy. I always tell my patients, he didn't get this way overnight or she didn't, and we're not going to get them out of it. We're going to be patient. I'm setting you up for success by going slowly. So, one, I get them on digestive enzymes with DPP-IV. I'm minimizing the withdrawal as much as I can. And then that constipation begins to clear up. And guess what? Unseen to us, I can't prove it, but I'm thinking the acid reflux is going away because now they're starting to sleep better. And
Mhm.
it's not that they needed sleeping pills to sleep, they were like deficient in sleep medicine. Acid reflux, whether they can tell you that or not, is usually the reason why they can't sleep. When we're upright during the day, gravity keeps stomach acid in our stomach, but at night we lie down. So ask yourself, does your child sleep better sitting up in the recliner or the car? Do they wake up frequently throughout the night or wake up early for the day at 3 in the morning or can't fall back asleep? Even if they don't feel burning in their chest and tell you, no, I don't feel anything, usually it's acid reflux. Okay, so getting the bowels moving helps everything move in the right direction, including acid reflux. And so now we have a calmer house. Not only is the child better rested, the parents are better rested, the siblings, the whole house works better when everyone gets a good night's sleep
Yes.
and everybody's pooping. It's amazing. Okay. Then I begin to slowly start to rehabilitate the microbiome. And I think of it as a garden. And I have a few rules in my garden. Okay. So, one, no flamethrowers. We're not going to come in and do these massive candida cleanses. These are usually children we're dealing with. I treat adults as well, but there's no need to do that. Why would you do that? Then you're going to have this massive die off effect. They're going to get cranky. It's going to blow up in your face and you're going to quit. Okay. So, again, they didn't get there overnight. We're not going to drag them out of it overnight. So, we're going to go low and slow. Okay. We're going to do one thing at a time so we know what kind of effect it has. And we're going to start going out into our garden gently every day and just pulling a few weeds. Okay. Now, we don't want to create havens either. That's one of my other rules, no havens. All right. So if I only go out into my garden and I pull only dandelions, great. I have less dandelions. The garden looks better, but the other weeds are going, hey, you just made a lot of room for me to spread out and grow in. I like that you're getting rid of my competition. Okay, so if you're only using one herbal antifungal or antibacterial or only one prescription like diflucan or ketoconazole or something like that, it doesn't kill everything. And so the other little critters in there are going, thank you. We're just going to move right in here and set up shop. So you'll find yourself saying things like, well, it worked for a while, but now he's yeasty again, and now it doesn't work. No, it worked. You just created a haven. So you need to rotate. Okay. You cannot use the same thing forever, whether it's herbal or prescription. Now, I do prefer herbals, not just because I'm a chiropractor, but because they tend to stay in the gut. They don't get into the whole system and tax the liver. They're a little easier on a child. And I just start rotating. I rotate things weekly. Okay, so one week I might use olive leaf extract or I might use uva ursi, whatever. The next week I'm going to put that one away. I'm not going to use two of them at the same time because our kids are sensitive. And then I move on to something else, okay? And I'll pick three and I'll rotate through those. I love to throw in a beneficial yeast called Saccharomyces boulardii, which I tell everyone we pronounce Sac B from now on, okay? That's okay? Sac B, and it does wonderful things for inflammation in the lining of the gut. They actually think it does some great stuff for the autistic brain. It's just a wonderful product, and it will not set up shop in your child's gut. Okay, so I really love it, but I don't use it forever. Okay, I rotate. Okay, and I use little tiny quantities. There's little liquid supplements you can find for children that don't taste too bad. Now, something like berberine or oregano oil, oh my gosh, you're not going to get that into anyone, right? Okay.
Oregano oil is so brutal.
It's overwhelmingly flavorful, but there are things that they accept. Okay, so the last thing that I do is no crock pots. Okay, so here are my rules: no flamethrowers, no havens, no crock pots. Okay, so if you think you're going to treat something once and you're done, okay, that's not how weeding a garden works. Okay, so I remember with one of my sons, because even though all of them aren't autistic, siblings all in autism families tend to have gut problems. So the doctor would put him on diflucan for 3 months, and the color would come back into his cheeks, and his eyes would sparkle, and his lips he had the most beautiful red lips. And then as soon as we stopped the diflucan, gradually he became pale, he became lethargic, he'd get the little yeast rashes. And this was way back before I knew what I was doing, Dr. Chloe. I remember I've been doing this for decades. So I was making all the mistakes for everyone so that I could share it in my book, how not to do that. But I began to go, you just can't quit. Like if I go out and weed the garden and it looks great, but I come back 3 or 5 months later, it's going to be weedy, right? I mean, nature doesn't leave an empty patch of fertile ground, right? So I realized we had to have a maintenance plan. And that's really a piece that I feel like I brought to the table. I was learning from other doctors how to do rotations and things like that. And I had to sort of translate them to herbals. But the maintenance plan. So I don't pound my patients every day with herbals forever. I do it for a few months and then with little doses. And then I begin to back off. Maybe I'll go every other day. If nothing bad happens, I'll go once a week, but I never give it up completely. And so at that point, my patient is so much healthier. The microbiome has been mostly supported that I can go to a blend. They're not so sensitive anymore. Now, what I didn't mention was my middle step, probiotics. When you have a garden, you have to plant good things, okay? And I really use a high-powered probiotic that is guaranteed to get through the stomach acid, whether it's a powder or a capsule. And I don't know if I'm allowed to mention brands on here.
Please
I
do.
have no affiliate marketing. I do not make any money from these brands, but it used to be called Claire Labs, 𝐑𝐄𝐈𝐂𝐀𝐃, and they were bought out. Now they go by something like SFI, something international. But if you go to KLAIRE.com and look for their probiotics, they are fanatics. They have so many resources on their website. Just some of the best probiotics on the planet, in my opinion. A lot of clinicians that I know use them. And
Yeah, they're one of my favorite companies for probiotics also. They do a really great job. They have a pretty good enzyme also. I'm curious to see if they have the DPP-IV in any of their enzyme.
they do. They do. Now, they do have, or they did at one point have, I believe it was egg white in their enzyme formulation. And I can't always use that with all my patients.
Yeah.
And so I still use that for patients who aren't sensitive. I use Enzyme Complete with DPP-4 by Kirkman Labs, but my go-to is Trienza by Houston Nutraceuticals. Good old Dr. Houston. He's accessible. I'm telling you, Dr. Chloe, I don't make any money. I'm not pushing these products, but
No,
they
I
come,
you see me. I'm writing this down because I'm going
they
to try
come
them
they
for
come
the
to the big autism conferences. They've done it for years. They understand our patients. They know that we need clean products. We can't have a lot of additives. And I just can't say enough about the probiotics at Clear Labs or the
Yeah.
enzymes at Houston. But they're all good. But really, when people are on a budget, I have also found that an over the counter gummy probiotic that they get at the grocery store, it will help on some level. So I'm not saying it has to be this very niche probiotic or something. I've noticed that probiotics help. And if budget is a problem, really just about any broad enzyme blend, meaning it hits protein, starches, and fats, that has DPP-4, and it's in Roman numeral 4, so it looks like DPP-IV, really will get the job done. So I'm not trying to be snooty, but people always say, "What brand do you use at your clinic?" And
No, it's good to know. You can always sort of tinker with it, and causes all of these things end up adding up for parents, but knowing what moves the needle the most in your clinical experience is very valuable. And I can tell you that I haven't eaten gluten or dairy in years, and I'm going to give this a shot.
well, and let me also say, if you are going to eat gluten or dairy, to go organic, okay? Because we probably don't have time to get into it on this podcast, but the glyphosate problem with non-organic wheat, corn, oats, soy really causes gut inflammation. My patients always struggle with gut inflammation, and so I'm not going to do that to them. But
Absolutely.
yeah.
Anybody who wants to learn more about that, I did have Stephanie Seneff on the podcast early on, and she is one of the leading researchers on glyphosate and how it impacts the gut and the brain and all sorts of different aspects of health. So check out her book, Toxic Legacy, and check out that podcast episode because not many people listen to it, and it's one of my favorites. She's amazing. She's brilliant. I studied so hard for that podcast because I was like, I do not understand the 𝐏𝐼𝐃 pathway and all of these things that I know we're going to go into. But yeah, she was really fun. But yeah, glyphosate is absolutely terrifying.
Yeah. So I have 3 steps: the enzymes with DPP-4, the probiotics, and that antifungal rotation, weaning down to a maintenance plan that I never quite let go of. About once a week or two, twice a month, I'll hit the gut with a little I'll go out into the garden and weed again. Otherwise, it will go back to wild. It'll go feral again, which in today's environment is not good.
No, it's so easy to sort of let those different pathogens overgrow in the gut or in the garden. So, because I know a lot of the parents listening have their kids or have had their doctors recommend that their children just stay on Miralax indefinitely, what would you say is the harm of doing that? Why would you prefer not to?
I don't think that Miralax itself is quite so harmful, but you are ignoring a medical issue that is unsupported. And as Dr. Sidney Baker, a very famous Yale educated pediatrician who's very active in the autism world, said, chronic issues, they'll simmer along for years and then they become multifactorial. And I get autistic adults in as adults in their 40s and 50s, and they're very sick people. They've just had symptom suppression medications is all they've had for forever, and typically they're very violent. I'm kind of renowned for calming down the most violent patients. And I always say they're not violent. They can't tell you what's wrong if they're non-speaking, and their medical issues have really been ignored. You've paid attention to their symptoms and you have suppressed their symptoms, but they're just so sick as time goes on. I mean, why would we not appropriately support a medical issue? An overgrowth in the gut, I mean, that's where the immune system lives too. And of course, the autistic population is very prone to immune dysfunction. It's just amazing what falls out of the picture, that noise, Dr. Chloe, just falls. I always say, let's see what falls out of the picture. And they're like, this is the first fall and winter they haven't been hospitalized 3 times for bronchitis, or they aren't missing school and they don't have those gaps in their education at school anymore. And the therapists, oh my gosh, the therapists go, what did you do? Like suddenly little Billy or Susie is so clear headed and we're making all these leaps in therapy. I mean, I just feel like the child is being asked to power through immense brain fog and a illness burden and a disease burden while they're going to school and being asked to perform and take tests and go to therapy, and much less have a social life or try out for a sport team or anything. You know what I mean? It just seems impossible, this burden of invisible medical problems that they're powering through. So that's the problem I have with just putting them on Miralax or a sleeping pill or an antipsychotic for the behavior. Okay, their medical issues are not being addressed. Here's an analogy. I'll give you a perfect analogy. I love using this analogy when I'm speaking to a group of healthcare providers, especially ones with prescription pads. Okay, so I'll put up a slide of a horseback trail ride. People with the horses in a line going through some pretty woods. And I'll go, does anyone here ever do a trail ride? And a few hands will go up. And I'll go, have you ever been on a ride where one horse is getting kind of ill-tempered and acting out and just causing trouble? And a few nods. And I'll go, does the leader of the group get down and go, hey, does anyone here have an antipsychotic approved for irritability in horses? We have a schedule that we need to stick to. We have an agenda for today. We need to medicate this horse and get on with our agenda. And there's this uncomfortable shuffling and some giggling, and they're all like, no one does that. I said, no, they get down and they listen to the belly, or they check the hooves or under the saddle. They're looking for distress or dysfunction or pain, because this horse is communicating with its behavior. Okay. And I'm just like, but we don't do that for autistic children and adults. We go, here's an antipsychotic for those behaviors. Here's a sleeping pill for why they can't sleep at night. And here's Miralax, just, it won't hurt them. Keep them on it forever. And let's get on with our trail ride. They go to school. We've got to go to therapy. We've got to go. And, until you've been immersed in this life, it takes a while, even when you're immersed in it, to go, wait a minute, something's not right here. And parents aren't stupid, but then we're dismissed. What do we know?
And we're also overwhelmed. If you're in the
We
middle
are.
of the fire, you're in the middle of the fire. So it can be hard to see what's going on around you.
You are. It's not their fault at all. When I would go to conferences and then try to bring it up with my doctor, this is many years ago, I was told it was snake oil and I'd been on the internet too much. And if I heard the word pseudoscience one more time, my head was gonna fly off. And now, these are well structured research studies and mainstream journals, and they just didn't want to hear it. They didn't want to hear us. And so that's the problem I have with just suppressing symptoms. I'm not saying medication can't be helpful, but it shouldn't be. Even the American Academy of Pediatrics says medications are not the primary treatment for autism. And so if you're doing all these therapies or trying to get through school, your child still needs to feel well. You'll get way more bang for your buck and for the effort when all that noise has fallen out of the picture and your child's pooping and sleeping and digesting and can get their nutrition from their food. They quit chewing on their shirts and having all those pica-like behaviors, because now they can break down their food and get their nutrition. Like, all these crazy things fall out of the picture. I'm so passionate that I believe this is the place to start, the gut, with these enzymes and the probiotics and the mild antifungals and antimicrobials, and just see what falls out of the picture. And I've started informally calling it the 80-80 plan. No, I don't have numbers to back this up, but my clinical observation tells me that just these 3 steps, enzymes with DPP-IV, probiotics, antifungal rotation, about 80% of the problems fall out of 80% of my patients' pictures. And it's just, now we're ready for school. Now we're ready for therapy. Language returns a lot of times. I never promise language, but that brain is so fogged under for some. And these opiate like peptides from the wheat and the dairy we're not digesting properly can occupy receptor sites in the language areas of the brain. And we're not quite sure the mechanism, if it's just calming down brain inflammation. We are not sure, but I'm always thrilled. I've had hundreds of patients regain language or improve language. Okay. And I never promise it. I have plenty of patients who never got a word, and we're just batting for vibrant health for them. So
I love that. And it's so, I mean, I harp on the gut so much too because it's just so essential, the gut brain axis and how they interact. I have so many different directions I want to go in about this, but I will just tell you a little anecdote with Remy. Remy used to have cluster seizures with the full moon every month for 5 days, 10 to 12 seizures a day. It was hell on earth for both of us, just the two of us riding it out, trying to figure out if it's too dangerous or not, and no sleep. Did a parasite cleanse on the recommendation of one of his doctors. So, and the seizures went away largely. And it's just astounding when you see kids with special needs, the connection between the gut and the brain is so obvious. And I think it's so important, as you said, to look for those signs as to what's going on underneath, like those activities, the aggression, the frustration that you might be seeing with your kiddos. Try and unearth what is actually happening beneath, because, as you said, so often Western medicine just tries to give us a pharmaceutical in order to put a band aid on top of those symptoms. And what terrifies me the most is how many different pharmaceuticals so many of these kids are on, because it's like, I understand that farms have their place. I feel like it's rare in kids, but I also live in the seizure world. Kids are going to be on pharmaceuticals, but many of the children with my son's disorder are on 5 or 6 different pharmaceuticals, and then every year or every other year they're just adding more and more on, and it just absolutely terrifies me because we have no idea how these meds are interacting within the body. And as you said, we're not addressing the root causes, so these issues are just compounding over time.
they are. And I do want to point out, since we both love the gut so much, and that gut brain connection is in my patients, at least, and I suspect in patients with seizures, there's inflammation going on. Inflammation is often a trigger for seizures, but inflammation is very big on the autism spectrum, body wide, including the brain. In fact, they're supposed to have a lot of them more inflammation than a child with meningitis. Can you imagine trying to get through your day with that much brain inflammation? That's why you say their name 10 times to get their attention. And so I never promise this. I don't test for or treat brain inflammation, but clinical observation, I've had lots of years for that. And just doing this simple gut support and getting that microbiome in good shape and seeing them get healthier, their eye contact improves a lot of times. They're quicker. It's like they have this brain clarity now. And I never promised this, but in the book, I did detail one adult case, I believe. And he was having lots of seizures every week. In fact, when he first came to me, he had recently fallen during a seizure and broken his eye socket. And so it was causing all kinds of problems. But after just supporting his gut, with the basics, I consider what I do very basic. He was having seizures maybe, I think I wrote in the book, twice a quarter or something, and they were milder. Now, does everyone get that? No. But if it helps, so there was a gut brain connection there. I did nothing for his seizures, but I supported his gut, and those also calmed down. That's like we've pointed out, the gut is where 80% of the immune system lives. I do not treat allergies or asthma, but after about a year and a half of good gut support, my patients come in, they aren't using their inhalers. The kids aren't getting sick. They aren't on those allergy medicines, except maybe during the height of spring or fall, instead of all year round, like the doctor used to have them on them. And so that it allows the body to come back into balance. The body's doing the work here. We have to set it up to succeed, and then see what falls out of the picture.
Yeah, it's so true. And building those foundations take time, but they're also super rewarding. And it's something I always encourage the entire family to do along with their kiddos, because the better you're nourishing your gut, the better you're also going to manage the stress that's coming your way through being a special needs parent, which is both magical and exceptionally challenging at times. I'd love to switch course a little bit to learn a little bit more about developmental ophthalmology, because I remember when Remy was younger, I got a couple of books on how vision impacts the brain, and it seems like vision is connected to a very large portion of the brain. I never did much of a deep dive in it, but what are you seeing with your patients, and what do you see when you refer out to a developmental ophthalmologist, and how's that sort of connecting to neurodevelopment?
Well, I'll go back to my earlier days as an autism mom, and I had the clumsiest kids on the block. I mean, they never got picked for anything. It was kind of heartbreaking. I would go to a ball game and just be astounded at how coordinated the other kids and how they could hit the ball with the bat or kick the ball. And I was like, dang, because I was pretty athletic as a young person, but my kids did not get that. And in fact, and here's something I feel super guilty about. Okay, but you'll get this. As my oldest son got older, he was a pretty big, muscular guy, and he would go slamming through the house and he'd bump into things. I mean, if something was a foot back from the edge of the countertop, he would still manage to pass by it and knock it off and crash. And he would go, "Oh, sorry, why was it so close to the edge?" Well, he'd bump into the door frame as he went through, or he'd trip over. It was just kind of weird. And so then as they get to be older teenagers and you think about this lurch person driving, you're like, oh my God, it's scary, right? And I actually nicknamed him Lurch. I am not proud of that. Okay. I just am not proud because I didn't know. I didn't know. But then I mentored under, let's see, he must have been about 13 or 14. And I mentored under the world renowned, I love her to pieces, Dr. Elizabeth Mumper. She used to be the medical director for the Autism Research Institute. She's an international expert. I mentored under her, and I had to stay there for a week and follow her through her practice. And I stayed nearby, and she gave me this little booklet called Seeing Through New Eyes by Melvin Kaplan. And she said, here, you might want to read this in the evenings. And I thought, oh, I don't want to read anything in the evenings. I'm like, whatever, I'm tired. But I read that, and it was so life-changing. It's a little thin book, and people don't have to read it. But I began to, it was like, these things, but you don't, you're busy, you're caught up in it all. Vision is one of the five senses, and we have a child with sensory issues. His brain is not processing all of those overwhelming incoming sensory signals. And the point is, we have two eyes, and so each eye is giving the brain duplicate information. If the brain isn't processing it well, a lot of my patients see double, but they think everyone sees double. Okay. So being able to converge your eyes and only see one of something gives us depth perception. And it's very helpful for going up and down stairs or for catching a ball. I leaned over to one of my little patients one time at the intake because I could just tell from my screening questions that he couldn't see. And he was on a little soccer team, and the mom and grandmom were saying, oh, he's awful. No one ever wants him on their team. And he was the cutest thing. And I leaned over and I said, how many balls do you see? And he said, two. And he just was telling me he saw two balls. And the grandmother and mother were like, why didn't you tell us? And I said, it's his normal. He thinks everyone sees two balls. And so I sent him off to the developmental optometrist who gave him some prism lenses. They don't look goofy. They look like regular glasses. And he was so proud the next time he came to see me a few months later. And he said, now I know which ball to kick. And he was doing much better. But you can't just call them up and say, I want an eye exam. They're a regular eye doctor too with extra training. You'll get an irregular eye exam. You have to say, I want a developmental evaluation or a behavioral workup, is what they also call it. And it's very interactive and it's longer than a usual 30-minute eye visit. And so I often tell people, wait until you get through the gut piece of my plan so that we have a better rested child, maybe a more verbal child, a child who can listen better, doesn't try to go through all that brain fog and do this exam. Okay. But they'll test how the eyes work together, how the brain is using the eyes. So a regular eye doctor checks the eyes. They do a great job. There's nothing wrong with that. That's like a mechanic checking a car. Okay. But it doesn't explain why your son is a bad driver, right? You have to look at the driver. You have to look at the brain. You have to look at how the kid is driving the car, right? And that's what the developmental optometrist does. And I don't know all the big words they use to describe what they do, but they're seeing what the child needs to see better. Parents will go, he just got his eyes examined. He got new glasses. His eyes are fine. 20/40, we just have lenses. And I'm like, his eyes are fine, but his brain's not using them well. Okay. And that makes it really hard to look at the board and copy from that to the paper. He's not converging properly. There's 3 different visual systems that are in use for that kind of task or to catch a ball or for things like that. And lenses, just seeing clearly is just one part of that. And he needs to be able to coordinate the eyes and use them as a team. So I hope I kind of explained what they do. It's beyond my understanding what they do, but it's a miracle in my office. I send over half my practice. It's life-changing. They can drive, they can go to college, they can be on the sports team, they're more confident. It's all around a miracle for my patients.
Yeah, I find it to be a really important missing piece for a lot of kiddos and adults who are navigating this. I know Remy always does like a side eye at people,
Yes.
and people think it's so funny. I'm like, no, I'm pretty sure he just sees double, so he's crossing out one of you so that he can see you better.
Well,
But I,
he's probably playing with his peripheral vision because for some people on the spectrum, the peripheral, ours is like a Univision movie. It's all integrated with our central vision. But for some people on the spectrum, it's completely separate. They see it as a separate field. Some see it as just colors.
yeah,
And so they're holding that toy up, playing and going between visual fields or looking sideways at things. That I do have, I'm not trying to promote my book, but I do have a section in there in chapter 1 where I put my visual questionnaire in there that a developmental optometrist helped me develop. Just a simple screen for the book to see if your child might want to do that.
yeah, I think it's great. I think it's a really interesting part of the puzzle for a lot of people out there. Speaking of vision and helping people get driving, I know you're working on a new book on removing the barriers to driving for people with autism. I would love to hear about that. I think that's something that must be so life changing for people once they're able to start driving and have that autonomy, and incredibly gratifying for the parents to be able to see their children do that. It sounds like such an interesting and cool topic. So I'd love to hear what you've been working on with that and what's coming out of that.
Well, again, it all comes back to me being an autism mom, and I did help 3 boys learn how to drive, 2 of whom are on the spectrum. And if I were a serial entrepreneur like you, I would have already invented my vodka patch that I could wear while I'm teaching. It's so nerve-wracking to teach anyone to drive. I mean, to
Yeah,
teach anyone to drive. But
sound of a
our
vodka
kids,
patch.
our autistic kids, have different barriers. They have this vision thing. That's the first thing I tell people is go to the developmental optometrist. Do not get in the car. Before I had one mom tell me, she goes, "Wow, every time we try to park against a curb, he lurches and bursts the tire, and he can't, and he hits the bumper of the car in front of him, and he just doesn't have any depth perception." And I said, "Well, drive today to the developmental optometrist and you drive, not him. He can't drive till after he gets these glasses." So it was inspired by all this white knuckle teaching kids to drive on the spectrum experience I had as a mom. And then I've had my clinic for years. So I've seen my little patients grow up and become driving age and hear all those stories. And I just knew that we have barriers, from the polypharmacy, from all the medications that they're on, to seizure disorders. There's a third of the spectrum folks have seizure disorders, to brain fog and brain inflammation, to sensory issues, to executive function differences. And so there's lots of books out there on the bookshelf at the bookstore on how to drive, but there aren't any for how to prepare to drive, how to remove barriers if you're on the autism spectrum. And luckily, the research is very reassuring, and with lots of practice and time, they're just as good as the other drivers. So it's not that they can't drive, and not all of them will drive. Some have higher support needs than others, and they're not going to be drivers, but they can have good community mobility. I haven't had time. I haven't had time to write this book. I was writing my other book, and I was being a mom, and I was doing my clinic and things like that. And I just decided this year it needed to happen. I actually had an agent. It's really hard to get an agent for a book. Okay. And so I had an agent for a year who was trying to get a publisher for this book. And he said, Janet, they're not going to understand. They're not going to understand the need. They're going to go, why isn't this a magazine article? They have no idea all the barriers that people with autism have. And so we did not get a publisher interested. And I finally this year, I'm getting older, and I thought, I'm just going to blog this book to life. I'm going to start blogging it this year. And at the end, I'm going to compile it into a book, add all kinds of great bonus content. I'm going to add a companion workbook. And I do so much of my work pro bono. I don't think I told you, but I don't take a salary at my office or anything like that. And my nonprofit helps me do that quite a bit by paying for things for patients. And so I don't even anticipate selling this book for much. I don't know if you can sell a book for free, but I'm hoping to give it away, or it ought to be blogged. I mean, the information will be out there. But it's on my website right now, janetlintala.com. And you go to the blog tab, and there's two blogs. One is a general blog where I put all the companion articles, and then I have the driving blog. So the driving blog is what will become the actual book. And the companion articles will likely, a lot of those will make it into the workbook. Like when we say our kids struggle with executive functioning differences, well, what does that mean? And how can we help that? And so I'll have a companion article posted on, here are steps you can do. I'm an action girl. I want actionable steps. That's why I wrote that first book. I was so frustrated years ago. There were lots of books coming out at the time talking about the gut and the immune system, but didn't give us step 1, step 2, step 3, things to do at home. And I like those actionable steps. And so this will be an action book. Okay. So, and it's for autistic teens and adults themselves, it's for their parents, and it's for driving professionals. So I'm hoping to educate. There's some out there that really know what they're doing and have a lot of autistic clients and they understand them, but there's a lot that have never worked with one before and they don't know what to do with them. So
Yeah, that's so interesting. I had no idea that you did not take a salary. That is wild. It's cool that you're doing it through the nonprofit. It's been a model I've played with certain things, but it's tricky. It's always tricky. But I love all of the various different projects you're working on, and I think it so shows the love and the passion of a mom and a practitioner. And similarly to you, it's like we learn from our mistakes and then we try and help others avoid those
avoid
mistakes.
them.
Have a somewhat easier path forward. It's like I don't know everything, but I know not to do that.
I have a great flamethrower story in the book. I don't call it that, but remember how we said it was my mistake. I had never worked with an prescription antifungal before. The doctor said, here, give him this. Didn't warn me, didn't say what the side effects might be, nothing. And so I sent him off to school on a Friday morning with a fresh dose of diflucan. And then that evening, it was Friday evening, we went out to dinner as a family. And then our little mountain town in West Virginia was getting a brand new Sam's Club. Everyone was so excited. We went to visit our new Sam's Club. And he immediately, of course, he had just eaten. He said, I have to go to the bathroom. And in he goes into the bathroom. Well, he's too old for me to go in with him. So I'm waiting around outside and it's taken a long time. And so finally I sent in my oldest son and he was in there quite a while and he came out and he had a really funny look on his face. And I said, what's going on? He just looked funny and he goes, there's poop on the ceiling. And I went, oh my gosh. So I sent my husband in there, and he was in there for 25 minutes. I'm pacing outside. I'm frantic. I'm going, oh my gosh, what is going on in there? He came out and he goes, get a manager and go buy some new clothes. And we cannot come back here for 6 months. So my child had exploded in diarrhea in 360-degree direction. The ceiling, the floor, the stalls, himself. It was just colossal. And it was this brand spanking new Sam's Club. It was all shiny and clean. I was so embarrassed. He was embarrassed. Poor thing. And so I learned why. I mean, this doctor was famous and didn't even warn me. Oh, it might cause a little gas. It might cause a little diarrhea. Don't go out to a party, when you've just taken a fresh antifungal for the first time. And so I have made all the mistakes. I forget how we went down this squirrel hole, but it
I
was fun.
love this. I love this one. No, it's so important though that like I think as you mentioned earlier, like we all want everything done yesterday. And I
Yes.
think as special needs parents, we are trying to do everything we can as fast as we can to support them because it feels like the sooner you can do it, the better they're going to do. The more you can help, the more you'll get to sleep one day. Um, but it is really important to do things in steps and to make incremental shifts as you go along because, as we said,
Mhm.
these kids are more sensitive to the things we're giving them, and it
Mhm.
can have significant 360-degree ramifications.
Well, and our special needs families are more fragile. We're holding on by our fingernails, juggling so much. And something like this can make us quit. And then we don't get the benefit of having explored that therapy fully. So, yes, baby steps.
All right. Well, I think we're just about at time for today, but I will link all of your information in the show notes, and I encourage everybody to check out the blog and all of the articles that Dr. Janet has put up. It is an incredible amount of resources, and I personally am super grateful for all of them. Dr. Janet, do you have anything else that you'd like to share with other moms and parents who are navigating the terrain of supporting a child with autism or with other neurodevelopmental challenges?
Start with the basics, get the noise out of the picture, and don't rush. Rushing is the enemy.
Wonderful. Thank you so much. This has been such a fun conversation. I
It
really
has been
appreciate
fun.
your time.